If you're an older man who still masturbates, there's something important I want you to ask yourself. Have you ever wondered privately, is this still healthy now that I'm over 50, 60, or even 70? Or perhaps you've worried that you might be damaging yourself, weakening your prostate, affecting your erections, or somehow making your sexual health worse as you get older. If you've had these thoughts, you are certainly not alone. In fact, this is one of the most common questions older men have, yet it is rarely discussed openly. Many men hear completely different opinions. Some people claim masturbation is harmful, while others describe it as necessary for good health. And somewhere between those two extremes, many older men are simply left without clear information. That is exactly why I want to have this conversation with you today. There should be no embarrassment, no judgment, and no reason for you to suffer quietly because you have questions about your own body. I'm Dr. Rose, a practicing urologist, and over the years, I've worked with thousands of men dealing with sexual health, urinary concerns, prostate issues, confidence, and the natural changes that come with aging. What I've learned is that men deserve honest information that helps them make informed decisions about their health. So today, we're going to discuss something that many men want to ask, but may feel uncomfortable saying out loud. I'll take you through 10 potential benefits of masturbation for older men, and then we'll look at 10 important risks and mistakes that you should understand if you want this activity to remain healthy. One of those risks is particularly important because ignoring it could mean overlooking a larger health problem. Before we get into the science, if you find conversations like this useful, take a moment to like the video and leave a comment telling me where you're watching from. It's always encouraging to see men from different places coming together to talk openly about health. And if you haven't already, subscribe so you can continue receiving practical, science-based information about men's health as you age. Now, let's begin with the good news. Masturbation does not automatically damage your body, reduce your sexual ability, or shorten your life simply because you are getting older. For many men, it can be a normal part of sexual health when it is practiced consciously and in moderation. The important question is not simply whether you masturbate. What matters is how you do it, how frequently you do it, how your body responds, and whether the habit is adding to your well-being or beginning to interfere with other areas of your life. That distinction is extremely important. Too often, men focus only on whether masturbation itself is good or bad, when the real answer is much more individual than that. Your overall health, medications, sexual function, relationships, stress levels, and physical comfort all matter. And that is why we need to look at both sides of the issue instead of relying on myths or outdated ideas. So, let's talk about what we actually know. This isn't a discussion based on locker room stories, internet rumors, or the shame that many men were taught when they were younger. It is about understanding the male body as it changes with age and looking at what research in urology, hormones, sexual medicine, and psychology can tell us. Studies have examined ejaculation, prostate health, sexual function, stress, sleep, and psychological well-being, and the picture is more balanced than many men realize. Masturbation may offer certain benefits, but it can also become problematic when it is excessive, physically aggressive, compulsive, or used to replace real human connection. Understanding both sides gives you something much more useful than a simple yes or no answer. It gives you the ability to recognize what is healthy for your own body and when a particular habit may be telling you that something needs attention. Let's start with one of the most important areas for an aging man: penile health. Erections involve much more than sexual pleasure. When an erection occurs, blood flows into the erectile tissues of the penis, including the corpora cavernosa. That blood delivers oxygen and nutrients and helps maintain the flexibility and function of those tissues. Regular erections may therefore play a role in maintaining healthy erectile tissue. As men age, changes in circulation, hormones, nerves, medications, and overall health can make erections less frequent or less firm. Masturbation can provide one natural way for some men to continue experiencing erections and sexual stimulation. Think of it less as a requirement and more as one possible way of keeping the system active. But remember, if you notice a major or sudden change in your ability to get or maintain an erection, don't simply assume it is because you are getting older. Erectile changes can sometimes be an early sign of conditions such as cardiovascular disease, diabetes, medication effects, or hormonal problems. That is why paying attention to changes in your sexual function can be an important part of taking care of your overall health. Another area older men often ask about is the prostate. Ejaculation has been studied in relation to prostate health, and some research has found an association between more frequent ejaculation and a lower risk of prostate cancer. However, it is important not to turn that finding into a promise or a medical prescription. Masturbation is not a guaranteed way to prevent prostate disease, and the idea that ejaculation literally flushes toxins from the prostate is an oversimplification. Your prostate is a living gland with its own normal secretions and biological processes. What we can say is that ejaculation is a normal part of male sexual function, and research suggests there may be some relationship between ejaculation frequency and prostate health. For an older man, that means there is no good reason to believe that simply having an orgasm is automatically harmful to your prostate. In fact, sexual activity can remain a normal and healthy part of life well into your 60s, 70s, and beyond, provided you are comfortable, physically healthy enough for it, and not experiencing symptoms that require medical attention. There is also another benefit worth discussing: your pelvic floor. Every orgasm involves rhythmic contractions of muscles in the pelvic region. These muscles contribute to sexual function and also play an important role in urinary control. As men age, pelvic floor strength can change, particularly in those who have had prostate procedures or who experience urinary symptoms. Sexual activity may engage these muscles, although masturbation should not be viewed as a substitute for targeted pelvic floor exercises when those exercises are medically recommended. Still, understanding that sexual function and pelvic muscle function are connected can help older men become more aware of their bodies. Your pelvic floor is not something you should only think about when there is a problem. It is part of the system involved in erections, ejaculation, bladder control, and sexual sensation, so maintaining overall physical fitness and paying attention to changes in this area can be valuable as you age. And then there is stress. Many older men carry responsibilities that do not disappear simply because they have reached retirement age. Financial concerns, family responsibilities, loneliness, changes in health, and uncertainty about the future can all create ongoing stress. Sexual activity and orgasm can produce short-term changes in brain chemistry and may help some people feel more relaxed afterward. Hormones and neurotransmitters involved in pleasure, bonding, and relaxation can contribute to that feeling of calm. For some men, that relaxation may also make it easier to transition into sleep. But again, the key is balance. Masturbation can be one healthy way to relax, but it should not become your only method of managing stress or emotional discomfort. If every difficult feeling automatically leads you towards sexual stimulation, it may be worth looking at what is happening underneath that habit. Healthy aging is not simply about maintaining sexual function. It is about maintaining a broad range of physical, emotional, and social tools that help you feel well. And that brings us to another important point. Sexual health is not separate from the rest of your health. The way you feel about your body, your confidence, your relationships, your sleep, your stress, and your physical function all influence one another. For an older man, understanding this connection can completely change the way he thinks about masturbation. It does not have to be something surrounded by fear or shame. At the same time, it should not be treated as a magical solution for every health problem. The healthiest approach is to understand what your body is telling you, recognize what is normal for you, and know when a change deserves professional attention. And as we continue, I want to show you the other potential benefits as well as the mistakes that can quietly turn an otherwise normal behavior into a problem. Another potential benefit is the effect sexual activity can have on your mood and emotional well-being. After orgasm, the brain and body release several chemicals involved in pleasure, relaxation, and emotional regulation, including dopamine, oxytocin, and endorphins. These chemicals do not suddenly solve depression or loneliness, of course, but they can contribute to a temporary feeling of calm and satisfaction. For an older man who may be dealing with changes in routine, retirement, reduced social contact, or simply the emotional challenges that can accompany aging, maintaining a healthy sexual life can be one small part of maintaining a healthy sense of self. Sexual desire does not have an expiration date. Your need for affection, pleasure, closeness, and physical connection does not suddenly disappear because you reached a certain birthday. That is something I want older men to understand clearly. You are allowed to remain interested in your sexuality, and there is nothing inherently unhealthy about that. There is also a practical benefit that many men overlook. Becoming familiar with your own body can help you recognize changes earlier. When you regularly pay attention to how your genitals normally look and feel, you become more likely to notice when something is different. Perhaps you notice a new lump, an area of swelling, a change in the shape of the penis, a new curve that wasn't there before, a sore area, or a change in sensation. Conditions such as Peyronie's disease, testicular abnormalities, skin changes, or other problems may become noticeable when you are simply paying attention to your body. This does not mean masturbation itself prevents these conditions. It means that body awareness gives you a useful reference point. You know what is normal for you, and when something changes, you have a better chance of recognizing it. That matters because early evaluation can make a significant difference with many medical conditions. If you discover a new testicular lump, persistent swelling, unexplained pain, blood, or a significant change in sexual function, don't ignore it or wait for it to disappear on its own. Those are reasons to speak with a healthcare professional. Sleep is another area where some men notice a difference. Following orgasm, changes in hormones and neurotransmitters can promote relaxation, and some people find that this makes it easier to fall asleep. If you are lying awake at night with your mind racing, feeling physically tense, or struggling to settle down, sexual release may provide temporary relaxation for some individuals. But I want to make one thing very clear. It should not be presented as a treatment for chronic insomnia. If you regularly have difficulty sleeping, especially if the problem has lasted for weeks or months, we need to look deeper. Sleep apnea, medications, anxiety, depression, pain, urinary problems, nighttime urination, and many other medical conditions can interfere with sleep. Simply relying on masturbation every night may mask the underlying issue rather than solve it. Think of it as one possible part of relaxation, not as a replacement for proper evaluation when sleep problems continue. Another consideration is circulation. Healthy erections depend heavily on adequate blood flow, and the pelvic region contains a complex network of blood vessels, nerves, muscles, and organs that work together during sexual activity. When sexual arousal occurs, blood flow to the genital region increases. That is a normal physiological response. Maintaining sexual activity may help some men remain familiar with their erectile response and notice changes in function. But once again, I want to protect you from a common misconception. Masturbation is not a treatment for poor circulation throughout the body. If your legs become painful when you walk, you have persistent numbness, your blood pressure is poorly controlled, or you suddenly develop erectile difficulties, those symptoms deserve medical attention. The penis can sometimes act as an early warning system because the blood vessels involved in erections are relatively small. A change in erectile function can therefore sometimes appear before more obvious cardiovascular symptoms. That is why I never want an older man to dismiss a new erection problem as simply normal aging. Now, there is another area where masturbation may have practical value, particularly for men who are concerned about sexual confidence with a partner. Some men experience difficulty controlling ejaculation, while others become anxious because they are unsure how their body responds to different levels of stimulation. Learning to recognize the sensations that build toward orgasm can give you greater awareness. Techniques such as the stop and start method are sometimes used in sexual therapy to help men become more familiar with their arousal pattern. The basic idea is simple. Stimulation is paused before the point of no return, allowing the sensation to decrease before stimulation begins again. Over time, some men may become better at recognizing their own responses. However, if premature ejaculation is persistent and causing distress, don't assume you simply need more practice. There are behavioral techniques, counseling approaches, topical treatments, and medical options that a healthcare professional can discuss with you. Sexual problems are common, and you do not need to be embarrassed about asking for help. There is also something deeper happening in the brain when you remain sexually active. Sexual desire involves complex neural pathways involving motivation, reward, attention, hormones, and emotional connection. Those pathways do not simply disappear because a man gets older. Of course, libido can change with age, and that is completely normal. Testosterone levels may decline, medications may affect desire, chronic disease may influence sexual function, and emotional circumstances can make a difference as well. But maintaining an interest in sexuality can still be part of healthy aging. Some men become concerned when their desire changes and assume they are somehow losing an essential part of themselves. Others become concerned because they still have sexual desires and think they are too old to have them. Neither assumption is helpful. There is no age at which a man suddenly becomes inappropriate for wanting intimacy or pleasure. Your sexual identity can change throughout life, but it remains a part of who you are. Now, with all of these potential benefits in mind, we need to have an equally honest conversation about the other side. Because masturbation is not automatically healthy simply because it is a natural behavior. Almost anything can become unhelpful when it is done excessively, aggressively, compulsively, or in a way that interferes with your physical or emotional health. The goal is not to make you afraid of masturbation. The goal is to help you recognize the difference between a normal behavior that fits comfortably into your life and a habit that begins to control you. And the first risk I want to discuss is not physical at all, it is social isolation. For some older men, masturbation is completely separate from their relationships and causes no problem. But for others, it can gradually become a substitute for human connection. Instead of calling a friend, spending time with a partner, going outside, joining a community, or addressing loneliness directly, a man may repeatedly turn toward sexual stimulation because it provides quick comfort. That immediate relief can feel good, but it does not necessarily solve the loneliness underneath it. Human beings need connection. We need conversation, affection, friendship, purpose, and a sense that we belong somewhere. Sexual pleasure can be part of a fulfilling life, but it should not become a wall that separates you from the people around you. If you notice that you are consistently choosing masturbation over relationships, responsibilities, social activities, or meaningful experiences, take a step back and ask yourself why. The issue may not be masturbation itself. The issue may be an unmet emotional need that you are trying to manage through it. The second risk is much more physical and much easier to recognize. Excessive friction can irritate the skin of the penis. When a man uses too much pressure, moves too aggressively, or continues despite discomfort, the delicate skin can develop tiny areas of irritation or microscopic tears. These may produce burning, redness, tenderness, or swelling. If the skin barrier becomes damaged, bacteria can also have an easier opportunity to enter. Fortunately, this is usually preventable. Be gentle with yourself, avoid continuing when there is pain, and consider using a suitable water-based lubricant to reduce friction. Older skin may also be more sensitive or dry than it was when you were younger, so the amount of pressure that once felt comfortable may no longer be appropriate. Your body changes with age, and your technique may need to change with it. Pain is not something you should push through simply because you believe you need to finish. Pain is information, and your body is giving you a reason to slow down. Third issue is desensitization. Some men become accustomed to one very specific type of stimulation, often involving a particular grip, pressure, speed, or position. Over time, the nervous system can become strongly conditioned to that specific pattern. This does not mean you have permanently damaged your nerves, but it can make other forms of stimulation feel less effective. A man may then find that stimulation with a partner does not produce the same level of arousal, even though there is nothing medically wrong with his penis. This can create frustration and anxiety, which can make the problem feel even worse. One practical approach is to avoid always using exactly the same technique. Slowing down, reducing excessive pressure, varying stimulation, and allowing your body to respond to different sensations can help prevent your sexual response from becoming dependent on one narrow pattern. Variety and moderation are often much healthier than intensity. Now we come to a risk that I consider especially important for older men, because it can easily be misunderstood. Some men discover that they can achieve a firm erection during masturbation, but struggle to get or maintain an erection with a partner. If this happens occasionally, it does not necessarily mean that something is seriously wrong. Anxiety, relationship stress, fatigue, alcohol, medications, or simply being distracted can all affect sexual performance. But if the pattern is persistent, I do not want you to dismiss it by saying, "I'm just getting older." Erectile dysfunction is not an inevitable part of aging, and in some men, it can be an early signal of another health problem. Conditions such as high blood pressure, diabetes, cardiovascular disease, obesity, nerve disorders, medication side effects, and hormonal changes can all interfere with erections. Because the blood vessels involved in erections are relatively small, changes in erectile function may sometimes become noticeable before other cardiovascular symptoms appear. So if you repeatedly notice that your erections are strong during masturbation, but consistently difficult with a partner, it is worth discussing with a doctor rather than simply increasing stimulation or blaming yourself. The goal is not only to improve your sex life, the goal is to make sure we are not overlooking something important about your overall health. Another problem that can develop is nerve irritation from prolonged pressure or an uncomfortable position. Some men spend a long time sitting in one position, particularly when using a chair or another hard surface, and this can place pressure on nerves and tissues in the pelvic region. One nerve that deserves particular attention is the pudendal nerve, which carries sensation from parts of the genital and pelvic area. Prolonged compression can contribute to numbness, tingling, burning, or pelvic discomfort in some people. You do not need to be frightened by this, but you should listen to your body. If you notice numbness or pain, stop and give yourself time to recover. Change your position, avoid prolonged pressure, and do not continue simply because you feel you have already invested time in the activity. Sexual pleasure should not require you to ignore physical warning signs. And if pain, numbness, or altered sensation persists, even after you stop, that is a reason to speak with a healthcare professional. Persistent pelvic nerve symptoms deserve proper evaluation because they can have several possible causes. The next issue is more psychological. Masturbation can become an emotional escape mechanism when it is repeatedly used to avoid uncomfortable feelings rather than simply for sexual pleasure. Think about what happens when you are stressed, lonely, bored, frustrated, or worried. If your immediate response is always to seek sexual stimulation because it temporarily makes those feelings disappear, you may slowly develop a pattern in which the behavior becomes your main coping strategy. Again, the problem is not that masturbation exists in your life. The concern is when it becomes your only reliable way of regulating emotions. Healthy coping is usually broader than that. Exercise can help release tension. Talking to a friend can reduce loneliness. Spending time outdoors, maintaining hobbies, practicing relaxation techniques, or simply having a structured daily routine can give your brain other ways to manage stress. For an older man, these habits can be particularly valuable because emotional well-being and physical health are closely connected. If you have several ways to cope, one behavior is much less likely to become something you feel dependent on. Another burden many older men carry is guilt. Some were raised in environments where masturbation was described as dirty, shameful, sinful, or dangerous. They may have heard frightening stories about weakness, infertility, mental illness, or loss of masculinity. Even when they intellectually understand that these claims are not medically accurate, those early messages can remain deeply embedded in the way they think about their bodies. Years later, a man may still experience guilt after masturbation, even though the behavior itself is not causing physical harm. That emotional conflict can affect confidence, intimacy, and overall quality of life. If you recognize yourself in this description, I want you to understand that shame is not a medical treatment. You do not improve your health by punishing yourself for having normal sexual feelings. If guilt is intense or persistent, speaking with a qualified mental health professional who is comfortable discussing sexuality can be very helpful. Sometimes the most important change is not changing the behavior itself, but changing the way you understand and respond to it. Now let's discuss something that can happen when ejaculation becomes either extremely infrequent or excessively frequent. You may have heard people say that not ejaculating for long periods causes the prostate to become congested or unhealthy. That claim is often repeated far more confidently than the evidence supports. At the same time, some men do experience temporary pelvic or genital discomfort when they have prolonged sexual arousal without ejaculation, while others may notice aching or heaviness after very frequent ejaculation. The important point is that there is no universal number that applies perfectly to every man. Your body will give you useful information. If you masturbate several times in a single day for long periods and begin experiencing soreness, pelvic aching, skin irritation, fatigue, or a feeling of heaviness, that is a clear reason to reduce the frequency and give your body time to recover. You do not need to prove anything by pushing through discomfort. Sexual health is not a competition. What matters is how your body responds and whether the behavior fits comfortably into the rest of your life. There is another point that matters if you are an older man who is still trying to have children. Many men over 50 are not planning to become fathers, but some are, and age does not automatically eliminate the possibility of conception. If fertility is one of your goals, ejaculation frequency can become relevant because very frequent ejaculation may temporarily reduce the concentration of sperm in an individual semen sample. That does not mean masturbation causes infertility, and it certainly does not mean that older men should avoid ejaculation altogether. Sperm production is continuous, and fertility depends on many factors involving both partners. But if you are actively trying to conceive, discussing timing and ejaculation frequency with a fertility specialist can help you make more informed decisions. In general, spacing ejaculations by a few days may allow sperm concentration to recover, although the ideal schedule depends on the individual situation. If pregnancy has not occurred despite regular attempts, don't simply assume masturbation is the reason. A proper fertility evaluation is much more useful than guessing. And then we have an issue that has become increasingly relevant in the digital age: pornography. Masturbation itself and pornography are not the same thing, and it is important not to treat them as if they are inseparable. A man can masturbate without pornography, and he can also watch pornography without masturbating. The concern arises when repeated exposure to highly stimulating or increasingly extreme online material begins to shape expectations about sex, bodies, performance, or relationships. Online content is designed to capture attention, and the scenarios presented are often very different from real intimacy. If a man spends a great deal of time consuming highly stimulating pornography, he may begin to compare real-life experiences with unrealistic images or become accustomed to a level of novelty that a real partner cannot reproduce. For some men, this can contribute to difficulty becoming aroused during partnered sex or dissatisfaction with normal intimacy. If you use pornography, it can be helpful to remain aware of how it affects you. Ask yourself whether it is simply occasional entertainment or whether you are increasingly dependent on it to become aroused. Real relationships involve communication, affection, patience, imperfection, and emotional connection. Those qualities cannot be replicated by endless online novelty. At this point, you may be noticing a pattern. None of these concerns mean that masturbation is inherently dangerous for older men. The problem is usually the way the behavior is being used. Gentle, occasional sexual activity that feels comfortable and does not interfere with your relationships or responsibilities is very different from compulsive behavior that leaves you sore, isolated, anxious, or unable to respond to other forms of intimacy. This is why I always encourage men to look at the bigger picture instead of searching for one perfect number. There is no universal frequency that defines healthy sexuality for every man. One man may feel completely comfortable masturbating a few times a week. Another may do it less often and feel equally healthy. Someone else may notice that even a small increase in frequency causes irritation or fatigue. Your age alone does not determine the answer. Your physical condition, medications, sexual function, relationships, emotional health, and personal preferences all matter. And this brings us to an important question. How do you know when a normal sexual habit has crossed the line into something unhealthy? Start by looking at the consequences rather than simply counting the number of times it happens. Are you experiencing pain or skin irritation? Are you developing numbness? Are you avoiding your partner or withdrawing from social life? Are you missing responsibilities because you are spending too much time on sexual activity? Do you need increasingly intense stimulation to feel the same response? Are you unable to become aroused without a particular type of pornography or technique? Or are you using masturbation every time you feel stressed, lonely, anxious, or bored? These signs tell us much more than a simple weekly number. If the behavior is comfortable, controlled, and compatible with the rest of your life, that is generally a very different situation from one in which you feel unable to stop, even when it is causing problems. There is also something I want every older man to remember when thinking about sexual health. Your body does not need to perform exactly the way it did when you were 25. Aging naturally changes circulation, hormone levels, nerve sensitivity, recovery time, and sexual response. That does not mean your sexuality has disappeared. It means your body may require more time, more stimulation, more relaxation, or different expectations. Comparing yourself constantly with your younger self can create unnecessary anxiety. Instead, learn your current body. Pay attention to what feels comfortable. Notice changes that are persistent rather than becoming frightened by normal fluctuations. And if something changes significantly, especially if you develop pain, blood, a new lump, persistent erectile problems, urinary symptoms, or a sudden loss of sexual function, speak with your doctor. The goal of healthy aging is not to pretend your body never changes. It is to understand those changes and respond to them intelligently. So, after looking at both the potential benefits and the possible problems, what should a healthy baseline actually look like for an older man? The first principle I want you to remember is moderation. There is no single number that is medically correct for every man, because sexual frequency is highly individual. Some men may masturbate several times a week and have no problems at all, while others may prefer once a week or even less often. The important question is not whether you match someone else's schedule. The important question is whether your frequency feels comfortable for your body and whether it fits naturally into your life. If you are not experiencing pain, irritation, numbness, emotional distress, relationship problems, or interference with your responsibilities, there may be no reason to be concerned simply because you masturbate regularly. On the other hand, if you notice that you are repeatedly sore, exhausted, distracted, or unable to control the behavior, that is a sign to step back and reassess. Your body does not need to meet an arbitrary target. Healthy sexual activity should leave you feeling comfortable, not depleted or injured. For many men, using a lubricant can make a meaningful difference. As we age, the skin can become more sensitive and less tolerant of repeated friction, particularly if you are taking medications or dealing with conditions that affect skin moisture or circulation. A good water-based lubricant can reduce friction and lower the chance of irritation or small skin injuries. This is a simple step, but it is one that many men overlook. You should also pay attention to the amount of pressure you are using. If your technique has become very forceful over time, consider gradually reducing the pressure, rather than assuming more intensity is always better. Your nervous system responds to patterns, and constantly seeking stronger stimulation can make ordinary sensations feel less satisfying. A gentler approach may actually help you maintain a broader and more natural sexual response. And if you develop persistent redness, swelling, cracking, bleeding, or pain, stop until the area has recovered and seek medical advice if the symptoms do not resolve. Variety is another useful principle. If your brain and body become conditioned to only one specific type of stimulation, you may eventually find that other forms of sexual activity feel less effective. This is particularly relevant if you are sexually active with a partner. Changing the pace, pressure, position, and overall approach can prevent you from becoming overly dependent on one exact pattern. You can also allow yourself more time between stimulation and orgasm. Older men sometimes become frustrated because they expect their sexual response to happen as quickly as it did decades ago. But your nervous system may need more time now, and that is not necessarily a sign that something is wrong. In fact, learning to slow down can reduce performance anxiety and make sexual activity more enjoyable. You are not trying to win a race. You are learning how your current body responds. I also want you to become more attentive to physical signals. If you experience aching, burning, numbness, tingling, swelling, or a noticeable change in sensitivity, don't treat those symptoms as minor inconveniences that you simply have to tolerate. They are information. Sometimes the answer is as simple as changing your technique or allowing more recovery time. But persistent symptoms may point toward another condition that needs evaluation. For example, ongoing penile pain can have several causes. Pelvic discomfort can be related to muscles, nerves, the urinary system, or the prostate. Numbness can have neurological or mechanical causes, and erectile changes can be connected to vascular or hormonal health. This is why a doctor should be part of the conversation when symptoms persist. You know your body better than anyone, but a clinician can help you interpret what those changes actually mean. Another important part of healthy aging is understanding the difference between sexual activity and medical treatment. Masturbation can be a normal part of sexual expression, but it should never be used as a replacement for medical care. If you have persistent urinary symptoms, blood in the urine or semen, significant pelvic pain, a testicular lump, unexplained swelling, or a major change in erectile function, those symptoms deserve proper evaluation. Please do not tell yourself that you can simply flush it out by ejaculating more often. Your prostate does not work like a pipe that needs to be cleaned by force. Similarly, don't assume that avoiding ejaculation will protect you from prostate disease. The human body is far more complicated than those simple internet claims suggest. The best protection comes from regular medical care, appropriate screening based on your individual risk, physical activity, healthy nutrition, good sleep, blood pressure and blood sugar control, and paying attention when something changes. Your overall cardiovascular health is especially important because sexual function is closely connected to blood vessels. If you want to protect your erections as you get older, you should think beyond the bedroom. Regular physical activity, maintaining a healthy weight, not smoking, managing cholesterol, controlling blood pressure, and keeping blood sugar in a healthy range can all support vascular health. These measures are much more powerful for long-term erectile health than searching for a single sexual trick. An erection requires healthy blood flow, functioning nerves, appropriate hormones, and a coordinated response from the brain and body. If one part of that system becomes impaired, erectile function can change. So when an older man tells me that his erections are weaker than they used to be, I don't simply ask how often he masturbates. I want to understand his entire health picture. The same principle applies to testosterone. Men often assume that a change in libido automatically means they need testosterone. That is not always the case. Testosterone levels naturally change with age, but sexual desire is influenced by sleep, stress, medications, relationships, depression, chronic illness, and many other factors. If you have a persistent loss of libido, reduced energy, changes in muscle mass, or other symptoms that concern you, your doctor can determine whether hormone testing is appropriate. Do not start hormone treatment based solely on something you saw online. Good medical care begins with understanding the actual cause of a symptom rather than treating a guess. And there is another factor that deserves attention: medications. Older adults are often taking several medications at the same time, and some drugs can affect sexual desire, erections, ejaculation, or sensation. Medications for blood pressure, depression, prostate symptoms, and other conditions may sometimes influence sexual function. That does not mean you should stop taking a medication on your own. Absolutely not. If you believe a medication is affecting your sex life, discuss it with the doctor who prescribed it. There may be alternatives, dosage adjustments, or other ways to manage the problem safely. Sexual health is part of quality of life, and it is completely reasonable to bring these concerns into a medical appointment. Now let's return to the emotional side, because this is where many men quietly struggle. You may be physically healthy, but still carry years of shame about sexuality. Perhaps you were taught that talking about masturbation was unacceptable. Maybe you were told that sexual desire was something you should have outgrown. Or perhaps you have never had anyone explain the difference between normal sexual behavior and compulsive behavior. Whatever your background, you do not need to spend the rest of your life feeling guilty about having a body that responds to sexual stimulation. Shame rarely improves health. Understanding does. When you replace fear with accurate information, you can make better decisions. And if guilt, anxiety, or compulsive sexual behavior is interfering with your life, talking with a qualified therapist can be a sign of strength, not weakness. Your relationship with a partner matters too. If you are married or in a long-term relationship, masturbation does not automatically mean you are dissatisfied with your partner. Many couples have different levels of sexual desire, and individual sexual activity can exist alongside a healthy relationship. Problems tend to arise when secrecy, deception, pornography, or compulsive behavior begins damaging trust or replacing intimacy. Communication can help. You do not necessarily need to share every private detail, but you should be able to talk honestly about affection, sexual needs, comfort, and concerns. Real intimacy is not only about achieving an erection or reaching orgasm. It includes touch, trust, emotional safety, laughter, companionship, and feeling understood. Those things become increasingly valuable as we grow older. So if you are wondering whether masturbation after 60 is healthy, I want you to step away from the idea that there is one universal answer. For most healthy adults, masturbation can be a normal form of sexual expression. It does not automatically weaken the prostate, destroy testosterone, or make you less masculine. But that does not mean every pattern is healthy. The warning signs are the consequences: physical injury, persistent pain, numbness, compulsive behavior, isolation, dependence on extreme stimulation, relationship problems, or the use of masturbation as your only emotional escape. If none of those are happening, there is usually no reason to feel ashamed simply because you continue to have sexual desires. And if you are already experiencing changes, don't panic. Aging does not mean your sexual life is over. You may simply need to adapt. Maybe you need more time to become aroused. Maybe you need a different level of stimulation. Maybe certain medications are affecting you. Maybe your pelvic floor needs attention. Maybe your cardiovascular health needs improvement. Or perhaps you simply need reassurance that the changes you are experiencing are normal. A good urologist can help you separate normal aging from symptoms that deserve treatment. There is no prize for suffering silently, and there is no benefit in pretending that a problem does not exist. The sooner you understand what is happening, the more options you usually have. Ultimately, the healthiest approach is one based on awareness rather than fear. Know your body. Respect your limits. Use lubrication when needed. Avoid excessive force. Give yourself recovery time if you are experiencing soreness. Pay attention to changes in erections, sensation, urinary function, and pain. Keep pornography from becoming the center of your sexual life. Maintain real relationships and other ways of coping with stress. And most importantly, continue taking care of the fundamentals that protect your health long after the sexual moment has passed. Exercise regularly, eat a balanced diet, sleep well, manage your blood pressure, cholesterol, and blood sugar, avoid tobacco, keep up with appropriate medical checkups. These habits have a far greater influence on how you age than whether you masturbate a particular number of times each week. There is no need to feel that your sexuality has to disappear simply because you are getting older. Your body may change, but change is not the same thing as decline. You may not respond exactly as you did at 30, but that does not mean you cannot experience pleasure, intimacy, desire, and sexual confidence at 60, 70, or beyond. In many cases, older men actually develop a better understanding of their bodies because they have learned what matters and what does not. The goal is not to recreate youth. The goal is to make the most of the body and life you have today. And when you approach sexuality with patience, moderation, awareness, and respect, it can remain a healthy part of that life. So, what should you take away from this entire conversation? The answer is actually much simpler than many of the myths and warnings you may have heard over the years. Masturbation after 60 is not automatically good, and it is not automatically bad. It is a normal sexual behavior that can be healthy for many men when it is approached with awareness, moderation, and respect for the body. The important thing is not to become obsessed with finding a perfect number or comparing yourself with another man. Your body, your health, your medications, your relationships, and your level of sexual desire are all different. What matters most is whether this behavior is comfortable, controlled, and compatible with the rest of your life. If it supports relaxation, sexual awareness, and enjoyment without causing pain or interfering with your relationships and responsibilities, there is usually no reason to feel ashamed. But if it becomes compulsive, physically painful, isolating, or dependent on increasingly intense stimulation, then it is time to take a closer look and make some changes. If you want a practical baseline, think in terms of moderation rather than a strict rule. Some men may find that a few times a week feels perfectly comfortable, while others may prefer much less often. There is no medically required schedule that every older man must follow. The number itself is not the most important measure. Instead, pay attention to what happens afterward. Do you feel comfortable, relaxed, and physically normal? Or are you experiencing soreness, irritation, fatigue, numbness, pelvic discomfort, or emotional distress? Your body can give you useful feedback when you learn to listen to it. If you need lubrication, use it. If a particular technique causes irritation, change it. If your body needs more recovery time, give it that time. And if something hurts, stop. You never need to continue sexual activity simply because you believe you should finish. I also want to remind you that sexual health is part of your overall health. If your erections suddenly become weaker, if you develop persistent pain, if you notice a new lump or swelling in the testicle, if you see blood, if you develop significant urinary changes, or if your sexual response changes in a way that concerns you, please talk with a healthcare professional. Do not automatically blame aging, masturbation, or your testosterone level. There may be a simple explanation, but there may also be an underlying condition that deserves attention. Erectile dysfunction, for example, can sometimes be connected with cardiovascular disease, diabetes, high blood pressure, medications, or hormonal problems. The earlier these issues are identified, the more opportunities you may have to manage them effectively. Your sexual health can sometimes provide information about your general health that should not be ignored. And please remember that masturbation should never replace real medical care or become your only form of self-care. A healthy life includes movement, nutritious food, good sleep, emotional connection, meaningful activity, and regular medical attention. If you are lonely, reach out to someone. If you are stressed, develop several healthy ways to manage that stress. If you are struggling with your relationship, communicate rather than disappearing into isolation. If pornography is becoming difficult to control, take a step back and consider how it is affecting your expectations and real-life intimacy. And if guilt or shame has followed you for decades, understand that you do not have to carry those feelings forever. Your sexual health deserves the same level of compassion and honesty as every other part of your health. I know this may be a sensitive subject for some of you. Many older men have gone through their entire lives without having a completely open, respectful conversation about masturbation, erections, ejaculation, or sexual desire. Some were taught to feel embarrassed about their bodies. Others were told that sexual interest was something that belonged only to younger men. And many simply never had a doctor explain what is normal and what deserves attention. But getting older does not make you less deserving of accurate information. You do not suddenly lose the right to understand your own body when you reach 60 or 70. Your questions are legitimate, your concerns are legitimate, and your desire to maintain your health, confidence, intimacy, and quality of life is completely reasonable. There is also no reason to believe that reaching your 60s, 70s, or even your 80s means you are automatically past your sexual prime. Your body may need more patience than it did when you were younger. Your erections may take longer, your recovery time may increase, your libido may fluctuate, your sensitivity may change. All of these things can happen as part of aging, and none of them automatically mean that you are broken. What matters is understanding the difference between a normal change and a significant medical symptom. Aging should encourage you to become more informed about your body, not more afraid of it. Instead of constantly asking, "Am I still supposed to be able to do this?" ask yourself, "Is my body comfortable? Is my sexual function changing significantly? And am I taking care of the factors that support my health?" Those are much more useful questions. If there is one message I want you to remember from this entire discussion, it is this: you are not too old to care about sexual health, and you are not wrong for having sexual desires. Your prostate, your erections, your pelvic muscles, your brain, and your emotional well-being are all connected parts of the same human body. Treat them with respect. Don't let outdated shame make decisions for you, but don't let internet myths make decisions for you either. Instead, learn what the evidence says, pay attention to your own symptoms, and speak with a qualified healthcare professional when something changes or worries you. Healthy aging is not about pretending that your body never changes. It is about understanding those changes and responding to them wisely. Small, conscious choices can make a real difference over the years. Staying physically active can support circulation. Maintaining a healthy weight can reduce strain on the cardiovascular system. Managing blood pressure and blood sugar can protect your blood vessels and nerves. Getting enough sleep can support hormones, mood, and sexual function. Avoiding tobacco can protect circulation. Staying socially connected can protect emotional health. And approaching sexuality without unnecessary shame can help you maintain confidence and a positive relationship with your body. None of these habits is a miracle cure, but together, they create the foundation for healthier aging. Sexual health is not something separate from that foundation. It is one part of the larger picture. So, if you have been quietly wondering whether masturbation is still appropriate after 50, 60, or 70, I hope this conversation has given you a more balanced answer. You do not need to be frightened by the behavior itself. You need to understand how it fits into your life. Use moderation. Be gentle with your body. Avoid excessive friction and overly intense techniques. Give yourself time to recover. Be aware of how pornography affects your expectations. Maintain real human connections and never ignore persistent pain, numbness, swelling, lumps, blood, urinary changes, or significant changes in erectile function. Those are not things to simply accept because you are getting older. They deserve proper attention. And if you have been carrying guilt about this for years, I want you to hear this clearly. You do not need to punish yourself for being human. Sexual desire is a normal part of life, and it can remain part of your life as you age. What matters is how you choose to manage it. With awareness, respect, and balance, you can continue to protect your dignity and your quality of life without allowing fear or shame to control you. You are not broken. You are not past your prime. And getting older does not mean that every pathway to pleasure, intimacy, confidence, or vitality has to disappear. If this conversation gave you information you had never heard before, take a moment to like the video and subscribe for more practical, evidence-based conversations about men's health. And if you know another man who may be wondering about this but feels too embarrassed to ask, consider sharing this video with him. Sometimes the information someone needs most is the information they are too uncomfortable to request directly. And I would genuinely like to hear from you as well. What was the most surprising thing you learned from this discussion? Was there something you had always believed about masturbation that you now see differently? Share your thoughts in the comments, because your experience may help another man realize that he is not alone. Most importantly, remember that your age does not define your vitality. Your body may change, but you can still make choices that support strength, confidence, sexual health, and quality of life. Take care of your heart, protect your circulation, stay active, maintain meaningful relationships, listen to your body, and do not hesitate to ask for medical advice when something feels different. Healthy aging is not about trying to become the man you were decades ago. It is about becoming more informed, more comfortable, and more confident in the body you have today. Stay strong, stay informed, and take care of yourself. I'll see you in the next conversation.